So my name is Tyler. I'm going to be speaking today about obsessive compulsive disorder. Obsessive compulsive disorder is definitely a disorder that won't kill you, but it is a disorder that can take over your lives in many ways. By the time I'm done the speech, you'll understand the signs and symptoms, the causes, and the treatments. I think it's important to inform an audience about OCD because it affects you like when you're older, and we should be educated about it, so if it does happen to us or it happens to one of our loved ones, we'll understand how to treat it or how to deal with it. I myself am not connected to the disorder, like I don't have it, but one of my best friends was diagnosed in 10th grade. He started to get signs and symptoms of OCD, and he went to the doctor, and he would like take a shower, and he would wash his hands, and his mind would like, he'd be so nervous after that he was still dirty that he would develop a full body rash. So his doctor told him to stick with one soap and one shampoo and one cologne, any fragrance to use just one. So he went with VID01393, and that's all he uses. So now every time he uses it, he doesn't break out anymore. But I have a quick video. This lady's a clinical therapist, and she deals with anxiety disorders.
Social worker here in Nashville, Tennessee, and I'm with Expert Village. The topic today is how to deal with anxiety disorders, and I've told you a little bit about the most common ones. I had another one that I want to tell you that kind of shows up in the counseling room often. It's obsessive compulsive disorder. This disorder is a person just gets so hooked on a thought. They will worry and worry and worry and have fear and have fear and have fear. It just permeates their thinking. They will take one thought and just drive it into the ground, and it just wears them out. It just wears them out. And because of that, they have a lot of anxiety. They have a rush of feelings that come about because of this kind of fear. So this is the fourth one that I wanted to tell you about. It's the obsessive compulsive disorder.
Alright, so according to helpguide.org, OCD is an anxiety disorder characterized by uncontrollable, unwanted thoughts and excessive rituals that behaviors do to feel compelled to perform. When you think of obsessive compulsive disorder, you should break it down into two parts, the obsession and then the compulsions. Obsessions are uncontrollable thoughts, images, or impulses that replay in your mind and you obsess about them. The compulsions are the actual rituals that make you perform to make the obsessions go away. The most important thing about OCD is the signs and symptoms. According to helpguide.org, the first person that's going to understand that you have a problem is your family. You yourself won't understand that you have a problem because it affects your brain, and you're going to think that you have a normal brain, but it really doesn't function the way it should. Your doctor is going to classify your symptoms into either obsession thoughts or compulsive rituals. You can have both, but you usually have both, but it's very rare to have one or the other. An obsession thought would be like always feeling like you're contaminated by something, so like dirt, bugs. Also, like people with OCD don't really like to leave their house because they feel like they're going to harm somebody or harm themselves. A compulsive ritual would be washing your hands over and over again, or always calling a loved one to see if they're okay. They're constantly anxious and always worried about the people that they love. According to the National Institute of Mental Health, when you are originally diagnosed and you learn to accept it, you start to do the same rituals over and over again, and you perform the same tasks. People with OCD usually put about an hour to 2 hours a day into thoughts and rituals. It can really take over their lives, and it can affect their jobs. With knowing the symptoms, it gives us a better idea to understand the causes. There's not one set cause for OCD. There's many different theories. All theories are based upon your brain. Doctors and researchers think that your brain was infected as either a head injury or, say, a concussion, or you were born with the part of your brain that deals with anxiety and fear, so you're always fearful and you're always anxious. The one that I found most interesting was the one about it could be hereditary, and you get it from a family member, but they have done like stats, and they did research that says that like a mother that has OCD could have 3 children and none of them have it, so they ruled that out. With knowing the symptoms and the causes, we have a better understanding of maybe how to treat it. There's 2 different ways to treat OCD. The main way is therapy. It's one-on-one therapy with somebody that specializes in anxiety disorders. Therapy is called cognitive behavioral therapy. It pretty much puts you into an environment with what you're not used to. It makes you think. It brings out your fears, and it brings out your anxiety, and it shows you that it's okay to be anxious and fearful. And like an example would be like if you're afraid of spiders, like they'll put you in a room with spiders and they'll make you think differently about the spiders. According to the National Institute of Mental Health, the second is medication. The first medication that's prescribed are anxiety medicine, such as Xanax. The Xanax is given to you, so when you feel the obsessions, you can take the Xanax, so it'll calm you down and it'll be less stressful, so that you won't have to deal with the compulsive area of the disorder. The second is antidepressants. These are interesting because the moment that you take an antidepressant, it takes 10 to 12 weeks to kick in, and they don't really give this to children with OCD because the side effects cause you to always feel suicidal. And it's good. This medication, I believe myself, is better than the anxiety medicine because it treats depression and anxiety. So when somebody with OCD disorder feels down about their lives, they can take this and it'll make them feel better. To sum everything up, I think OCD will continue to grow stronger, and it'll affect many people, and I think our society should understand and be educated on how to treat it, and if one of our loved ones get it, to understand it.